I'm a GP and women's health and menopause doctor based in the UK, but I've also started my practice in Nigeria, which has been a lifelong dream because obviously that is where I was born and raised. So I know quite a few of the people on here are based in Nigeria. And our fellow speaker today, the wonderful Koyin Vera-Cruz, who I've literally known since I was a young woman, talking about from like 11 or 12, because we went to school together and we've basically ended up in this where we can actually do some work together as full-grown women.
Honestly.
And it's such an honor, really, to have her here. And I can remember when we started having this conversation, we saw last Christmas and we said we have to do this. So I'm so glad that we finally are here. So Koyin, I will let you introduce yourself for the third time.
Okay, for the third time. Thank you, Tunu. Thank you, Dr. Chu. So for the third time, I'm Koyin Vera-Cruz. I am a certified trichologist. I basically help women sort out any hair and scalp disorder or irregularity they have by pointing them in the right direction, whatever it may be, whether in our practice or referring them to the appropriate channel to deal with their situation. Our practice is on Kufu Abayomi in VI. And like Dr. Sho said, I was thinking about it earlier today as well, that we've known one another for such a long time. And it just feels so full circle that we're sitting here doing this today, So I'm really excited as well. And I'm really looking forward to it. I'm really glad to be doing this with you for sure. And I have a few of my clients on here who, when I forwarded the flyers to, they felt like they had to, join to listen because, they speak. I mean, we haven't gotten into the topic, but just speaking on hormonal health and hair loss is so pertinent to many things that many women in my clientele are experiencing right now. So I'm sure they're on here really looking forward to your insights on the topic and how we can sort of fuse and create something really special for them.
Amazing. Great. So what the format for today is both of us are going to give talks just to set the scene. So I'm going to talk about hormones and how they impact hair, and Koyin will talk a bit more about hair and scalp issues. And then what we really want is for this to be an open forum for people to ask questions. And we want to make sure that people feel that they're able to ask the questions that they want. So we're going to record the first half of it where we're giving our talks. But when it comes to time for questions, we'll stop recording so that people can feel safe and confident to be able to ask their questions without concern. So I'm going to start with my talk. So I'm going to share my screen now. So just confirm that you can see my screen if that's okay. Can you see my screen?
Yes,
okay,
I can.
Perfect. Okay, so we're going to be talking about menopause, hormonal health, and hair loss. Because as many of us know, in our journey through as women from puberty through our reproductive years, for those of us who've had pregnancies and had babies, and for those of us who are now navigating perimenopause and menopause and beyond, we know that our hormones have an impact on our hair. And therefore, I think it's pertinent that we have a conversation around it because it can really help guide us as to how we can maintain one of our really important assets, which is our hair. So who am I? I'm a GP. I've been a doctor for now it's nearly 15 years that I've been a qualified doctor. So I work as a women's health and menopause doctor, and I'm an advanced menopause specialist with the British Menopause Society. I'm a member of the Primary Care Women's Health Society, the Royal College of GPs Women's Health Significant Interest Group. So yes, a lot of women's health stuff. And I do a lot of advocacy as well as advocacy for women's health and women of color. So that would, if you would, that's my subspecial interest. I'm also EDI lead at the Royal College in the Northwest London faculty. I teach at medical school, but I also have had my own challenges with women's health issues. And that makes me combine those things to ensure that I'm providing tailored, personalized, and empathetic care for my patients. And I'm a dedicated advocate for health equity. So why is this important? Well, hormones affect hair, they do. And whether it's been pregnancy, some of us would have experienced changes in our hair, as I mentioned, in menopause, and, different medical conditions, or even stress. Stress can be a cause of hair changes because stress induces certain hormones, and we'll talk about that as we go along. So it's more than just hair. It's our hormonal balances, our hormonal atmosphere impacts our lives, our mood, our energy, our confidence, our wellness. And many people aren't aware of how closely our hormones and hair health are linked and what our hair can tell us about our actual body. So understanding your hormonal health can empower you for better choices for your hair, but also for your entirety of your well-being. Because we're not just our hair, but our hair is an important part of us. It's all about the whole person. So let's start with what hormones do we have. So this is a diagram that I've borrowed that I thought was quite good to give us a pictorial representation of what we call the endocrine system. So that's the system in our body that is dealing with hormones. Okay, so we've got the hypothalamus, which controls the pituitary gland. And the pituitary gland is like our boss hormone that controls all the other hormones. Very importantly, in our necks, we have the thyroid gland, and that contains body metabolism and energy levels. So it's a really important gland that produces some really important hormones, and that can impact hair. So remember thyroid, that's very, very important. Also, we have our thymus, which supports immune system development. We've got our pancreas. Some of you will know about pancreas because that's where insulin is produced, and that controls blood sugar. Besides the thyroid gland, we've got the parathyroid glands, and those control calcium. So an abnormality in that can impact your calcium levels. It's quite rare, but it's an issue. And then we come to the adrenal glands, which are really important because they help regulate metabolism, our blood pressure, our response to stress, our immune system. So the adrenal glands are very important, and they produce some really important hormones like corticosteroid hormones. And we will talk about the main one, cortisol, as part of our conversation. And obviously, as women, our ovaries are really important glands that produce three really in hormones, and that's estrogen, progesterone, and to a smaller extent, testosterone. Some testosterone is also produced by our adrenal glands as well. And we'll talk about how those hormones impact during the menopause and our reproductive lives. So let's just start at the very beginning. Let's start with puberty. What happens? So the brain, so that's the hypothalamus and the pituitary, they tell the ovaries it's time to start producing estrogen and progesterone. So our little girl bodies start changing, breasts develop, hips widen, height increases, and menarche. Menarche, that's the word, the medical word for your first period. Menarche starts and your period starts, and they can be irregular at first. And some of you, might be navigating this with your teenagers or young women. And, it takes a while to settle, but you also remember that with the hormones come emotional shifts as the hormones rise and fall. And it's really important to have these conversations with our young women so that they know what's happening with their body and they're empowered to be able to address these issues. So very important to kind of lay that foundation. So what happens in our menstrual cycle? So we've got the follicular phase where estrogen builds up until we get to that day where it's ovulation. We get the LH surge, and we release an egg, and that egg is released typically, if you've got a 28-day cycle on day 14, and then what happens is the estrogen starts to drop and progesterone starts to rise. And for those of you who've heard me talk about this, we know that when progesterone starts to rise, that's when we get the luteal phase, and often that can be associated with the premenstrual syndrome type symptoms. So the low mood, the breast tenderness, they're not feeling quite right. And that can range from mild and manageable to not manageable at all, and something called premenstrual dysphoric disorder, which can really negatively influence lives. I mean, some women in that phase can be suicidal. And these things require treatment because the hormonal changes in the body during the cycle can sometimes really cause women to feel quite unwell and unable to function. Now, did you know that you're born with 1 to 2 million follicles, but actually only 400 to 500 eggs actually get released over your lifetime? So from your first period around the age of 12 to 13, but we know that for women from Black or Asian communities, that can be younger and more kind of like 10 to 11, and to menopause, which is around 50 to 51. But we know that for women, again, from Black and Asian backgrounds, that can be earlier. So 48 is the average age for a Black woman, 46 for an Asian woman. Most women will spend roughly 35 to 40 years cycling. But of course, pregnancies can interrupt that, as well as taking contraceptive pills, because that can then alter how many years you spend cycling. Now, perimenopause and menopause. So what is perimenopause? So perimenopause is when you're moving from that regular monthly cycle pattern to the end of your cycles, which after 12 months of no periods is menopause. That period in between is called perimenopause. And that's when your hormones shift and your periods will become irregular. And that's often a primary marker of the perimenopause. But as we know, this is associated with a lot of symptoms, including hot flushes, sleep issues, mood swings, night sweats, and all sorts of things, vaginal dryness, lower libido, so many symptoms. I mean, some people say there's 70 symptoms, some say there's 100 symptoms of perimenopause, and every journey is unique because the timing and intensity will vary for each woman. So what happens to our hormones during this menopausal transition? So you've got estrogen, which each month as we cycle, we saw that in the menstrual cycle. Look at what happens to estrogen during perimenopause. It goes absolutely crazy, up and down and left and right. And this is why blood tests during the perimenopause can often be confusing. Because if you take it at, a top point, it could look exactly like if you were cycling. If you took it at the bottom, it'll give you some information to suggest perimenopause, but it could look just like the levels during your reproductive years. And so this is why it can be very difficult to diagnose with blood tests, and we call it a clinical diagnosis based on the symptoms a woman is having and what's happening with her periods. And then, of course, during postmenopause, once menopause hits and during the postmenopause period, estrogen drastically drops. Now, what happens with testosterone? So testosterone is not quite it doesn't quite fall off the cliff in the way that estrogen does, because as I've mentioned before, it's not just the ovaries that produce testosterone. We've also got the adrenal glands that produce testosterone. And this is quite important for our hair, because when we have less estrogen and progesterone around, then testosterone can actually then have more of an impact. And we'll talk about that in a minute. So now let's talk about how hormones affect hair health. But there's some words that you need to understand. So one of them is the phases of hair growth. So there's the anagen phase, which is the active growth stage of a hair follicle. And then there's the telogen phase, which is the resting stage, and it lasts around 3 months. And then the hair sheds, and this is natural, before regrowth. So this is a natural stages of hair growth. Now, we've also got this hormone, which we'll talk about, which is a powerful form of testosterone called dihydrotestosterone, and it's a byproduct of testosterone hormone that can shrink follicles and cause thinner hair. And when it does that, it does something called follicle miniaturization, which is that gradual shrinking of follicles, leading to finer, shorter hair that's, less, that is more fragile. Now, another phrase that I think is important for us to talk about is telogen effluvium, which is when you can get temporary hair loss from stress or from a shock to the system. So some women will experience this after having a baby. If you've had a bereavement or some stressful period like a divorce or something like that, you might just notice that your hair just starts falling out because it just forces the hair follicles to go into rest stage, and so it starts shedding, even though it's outside of the natural cycle of the telogen and the anagen phase. Now, how do hormones affect hair health? So estrogen is actually pretty good for our hair. It prolongs the growth phase. It helps with fuller hair. Progesterone also protects the hair follicles and lowers this DHT. Now, DHT, which is this testosterone on speed that you might want to call it, which shrinks the follicles over time. And there are certain conditions that women have that gives them a higher level of testosterone. And we're going to talk about one of them, which is PCOS, polycystic ovarian syndrome, and that can cause shrinking of the hair follicles. Now, the thyroid hormones. So it's really important to remember that the thyroid hormones are very important for hair growth because they control the growth and rest cycle. So they almost is part of their metabolic function. And so if you have an abnormality with your thyroid hormone, you can get an imbalance and shedding, which is why if you're having hair loss issues, it's really important to check your thyroid hormone. Another really important nutrient to check, is not a hormone, is your iron levels, because they also play a role in hair growth. So you will often hear me say when people come and talk to me about hair loss, to say we need to check your thyroid and we need to check your iron. Another really important nutrient is zinc. And I'm sure that we'll talk about all of these during questions and answers. Now, cortisol. Cortisol is a hormone that helps manage metabolism. But it's also our stress hormone. Now, there's healthy stress, which our body needs and we need to be able to function properly, but there's abnormally unhealthy stress. And many of us, with modern life, the mental load, women carrying a disproportionate load for society. Many of us are working full-time whilst also having caring responsibilities for younger members of the family, but also older members and the more vulnerable for society. But even if we don't have children, we're still expected to do so much more. And this stress that many of us live under can trigger stress-related hair loss. And the cortisol hormone can be responsible for this. Now let's talk about pregnancy and after pregnancy, which is the postpartum period. We get high estrogen. So during pregnancy, people often find, my hair is looking fantastic. There's less shedding, it grows well. And then after pregnancy, the drop in estrogen and progesterone can push hair into telogen, which is why it's very common for women to have the shedding peak of hair 3 to 4 months after birth. And of course, if you're not sleeping well, you're more stressed, your iron is low, because some women lose quite a bit of blood during that period, your protein or zinc is low, or you're breastfeeding, although please don't say that Dr. Sho said, please breastfeed if you want to. It can, all of those things, because basically the child is taking a lot of your nutrients. But, that's part of it. You want to, if you can, you want to breastfeed, but no pressure. We're also, not about putting pressure on women. Recovery usually takes about 6 to 12 months. So this is something to be aware of. And this is quite common. Now, I mentioned about PCOS. Now, this is a condition that I actually live with myself. So it's this hormonal disorder with imbalances in our hormone levels. These women will have high androgen, which is the testosterone and male hormone levels, and it's often characterized by irregular periods and issues with ovulation, and can be associated with fertility struggles, although not always. And it can also be associated with insulin resistance, often a metabolic disorder. Women are at higher risk of high blood pressure, diabetes, heart disease. So it's quite a huge hormonal disorder. But just thinking about the hair aspects of PCOS, because of these higher levels of the male hormone, which is the androgens, it shortens the growth phase and it thins scalp hair. So women can even get this male pattern baldness or hair reduction in the crown of the hair with PCOS, and it shrinks the DHT, which is this testosterone that is stronger, will shrink follicles. Now, because of this high insulin resistance issue, it can reduce blood flow and nutrients to the roots. Inflammation, because PCOS can be an inflammatory condition, it can damage follicles, increase shedding. And of course, the hormonal imbalance can push hair into the resting phase early, so you can get like a sort of almost like a telogen effluvium, which we described earlier, which hair shedding early or inappropriately because of the hormonal imbalance. Now, with thyroid issues, so both underactive and overactive thyroid can cause hair loss across the entire scalp, and often it will cause a change in the texture of the hair. The hair will be more friable, break easier. Again, abnormalities with the thyroid hormone can affect this DHT, which we'll keep talking about. And then it can shrink follicles as well. But once you have it treated, usually it improves, which is why, you know, thyroid checking is a really important part of assessing hair issues. And this is obviously something that we offer. Autoimmune issues that can cause thyroid problems, so Hashimoto's or Graves'. These are autoimmune conditions that can make the thyroid low or high. It can inflame the hair follicles and worsen shedding. And of course, autoimmune conditions, if you have one autoimmune condition, it can increase your chance of having other autoimmune conditions, and other autoimmune conditions can impact your hair loss as well. So now coming to the perimenopause and the menopause, because of the decrease in estrogen and progesterone, it shortens the growth phase and you get thinner hair. So many of you would have noticed, you know, as you enter into perimenopause and menopause, your hair might get thinner, just as your skin might get drier. And, you know, because of the less amount of the estrogen and progesterone, the androgens, which is the male hormones, so testosterone and DHT, are a bit more prominent. And so they can shrink the follicles and add to the issues, making it finer and more likely to break. And again, the hormonal changes can push the hair into a resting phase, and so you can get more shedding. So it can be a little bit more challenging, but you know, treatments can help, including treatment for the menopause. And of course, the mainstay of treatment, or the most significant treatment, or the best treatment for perimenopause and menopause, if you are symptomatic, not everyone is going to need treatment, but if you are symptomatic, is HRT, hormone replacement therapy. But there are other treatment modalities, and we can talk about that later. Now, stress and cortisol. So I talked about cortisol, which is our stress hormone. So when we're under so much stress, that cortisol can spike in our bloodstream, and it can push hair into this early rest phase and cause shedding. Again, it weakens the follicle stem cells. Again, it can cause inflammation, so the scalp becomes less supportive. For those of us who struggle with seborrheic dermatitis, which is a hair scalp condition that is triggered by a fungus called Malassezia furfur, where quite a few of us will get an allergic reaction. So some people will describe this as quite severe dandruff, but actually the condition is called seborrheic dermatitis. So that can be made worse. And for those who have that condition, you know, when you're stressed, the seborrheic dermatitis gets worse. So the scalp becomes less supportive for the hair. But it also, even if you don't have this condition, inflammation in the scalp will make it less supportive for hair. So again, when you're under chronic stress, you know, it makes it more difficult for your hair to grow, and it keeps your hair follicles in rest for longer. And so it doesn't regrow and go into the anagen phase as it should do. And also stress can change the pigment in the hair. And you know, they say, this child gave me gray hair, or this job gave me gray hair. So some people say that in a joking manner, but there's actually a medical, you know, line to it, that actually stress can change the pigment in the hair. And so what are the treatments? So there are certain, so if you've got, you know, the most important thing is that you need to have a consultation with a clinician, a licensed clinician who knows what they're talking about, is able to understand your individual needs, risks, and your medical history to direct you to what are the best blood tests and what are the best treatments for your condition. So, for example, with polycystic ovarian syndrome, there's certain pills that are anti-androgen and can lower your androgen levels and may help with your symptoms. Then, of course, there is spironolactone, which is a tablet. It will lower your blood pressure, and it can increase your potassium. So again, you need to speak to someone to see if this is appropriate for you. These are not drugs to just buy over the internet, please. And it blocks the androgen receptors, and it can help with hair growth. Finasteride, again, this is off-label in women. It stops testosterone. Some women use it, but again, it has a whole list of side effects. So, you know, it has to be in consultation to discuss why you would use it. And then HRT, I already talked about hormone replacement therapy, which can support your hair follicles in the menopause. Now, there are non-hormonal treatment options like minoxidil, which will help boost blood flow to the follicles, and it aids growth, and it can be used as an option. There's laser therapy, there's PRP, although the evidence for that is mixed, but a lot of people anecdotally find it really helpful, which is where they inject platelets into the scalp and it triggers regrowth. So again, it's something that can be considered or discussed. Supplements, I already talked about iron, biotin, you know, zinc, and all the different nutrients that support hair health. And then you know, they're herbal treatments, so, you know, that you can try. They're not going to harm you. So there's all sorts, you know, black castor oil, rosemary oil, saw palmetto, and they may help reduce hair loss. So again, you know, it's worth exploring. You know, there's so many sort of creams and herbal treatments that lots of people, if you wanted to try them, it's worth exploring. But unfortunately, the evidence base for a lot of these treatments are not quite as there as we would like. And that's because, you know, it's quite difficult to do research on herbal treatments. So again, you know, you can learn about these treatments and try them if you find them helpful, but always discuss them and make sure that they don't interact with any other medications that you're having. Now, it's important to understand your own hormones and your own body. So learn about your hormones, track your own cycles and what's happening with your body, spot patterns and changes with your own, you know, hair, your skin. How does your body react to your hormones? And, you know, notes, you know, it's because just be aware of your body, because the more you're aware, you know when something has gone wrong. Get information, like coming to something like this, know the signs, and so you know what's normal and when to seek help. And again, nutritional support is so important. So eat protein-rich foods, but healthy proteins to nourish your hair follicles. Stay hydrated, drink plenty of water. Be careful with excessive sort of tight hairstyles, heavy extensions, excessive heat, chemical treatments. And I know that Koyin will talk more about all of this. Use gentle hair care products and shampoos that are not going to dry out the scalp. And then, you know, at the very core of all of this is how we can keep our bodies healthy, is wellness. And movement, physical activity is fundamental to helping keep our hormones in the right balance. So movement, whether it be walking, cycling, strength training, yoga, Pilates, whatever, swimming, dancing, whatever you enjoy. And the thing is, again, I don't want this to seem like we're putting pressure on women. You find what movement works for you. I mean, I've probably mentioned this in previous webinars. I've got a friend, what she does is she puts on some gospel Afrobeats music and she dances for 15 to 20 minutes a day. She sometimes even gets her children involved in it. And that's her physical activity. It works for her. So you find what works for you. Good sleep is so important. Sleep restores our body. It restores hair repair, skin repair, and hormonal regulation. If you're not sleeping well, your hormones are going to be out of whack. It helps balance our hormonal health. So you do need to prioritize good quality sleep. Again, smoking and excessive alcohol, these are toxins. And so they will cause increased inflammation, they'll minimize dehydration, worsen your scalp health. So really trying to avoid that. Mental load management, those of you who have been on previous talks will know how much I am passionate about mental load management. Set boundaries, delegate tasks, practice self-care is so important. But you know, I also talk about spending time in nature. Nature is restorative. Green spaces help reduce our stress. It is so important, and it's a factor that improves our health. And so we have to take it seriously. We've already talked about eating healthily, but eating the rainbow. So having the right amount of antioxidants. So you want to eat fruits and vegetables of different colors and varieties. So not every day orange. Some days, you know, aubergines, avocado, sweet corn, you know, carrots. Just have a variety of, you know, strawberries. I know some things are depending on where you live in the world, but eat local, you know, and eat a variety. And they help supply antioxidants that support hormone regulation, skin and hair health. And yeah, a balanced diet to stabilize your blood sugar and maintain hormone equilibrium. So in summary, please embrace your journey. Your hormones are important for your hair and your overall health. Prioritize self-care, look after your body with healthy habits and make time for yourself. Continue learning and seek support. We're here to help you, and together we can break barriers and uplift every woman on her journey. So now, you know, Koyin is going to talk, but I just want to let you know that I'm available for consultation, both in the UK and in Lagos as well, in Nigeria as well. So I can see patients virtually in Nigeria. So you can scan the QR code to find out how you can book, and we can arrange blood tests and everything locally in Nigeria as well as here in the UK. So whatever you need for your hormonal health and your hair journey, we're here to support. And I just wanted to let you know about our free ebook, A Personal Guide to Menopause for Black Women. So if you don't have a copy of this, scan the QR code. You can get this free book to read. Now, if you want a physical copy or a Kindle copy, you can also find it on Amazon and buy it if you wanted it, if you wanted that version. But the PDF copy is available for free. Okay, so that's me done. I'm going to hand over to Koyin.
Thank you very much. That was so detailed. That was so informative. Even I learned so much from listening to you. Oh, and I'm looking forward to tying that information in with the information I have for the ladies we have on here. Okay, so let me share my screen and let's get right into it. Can you see my screen? Okay, you're muted, but yes, you can see my screen. Okay, hello everybody. For the fourth time, I'll introduce myself. I'm Koyin Vera-Cruz. I'm a certified trichologist with the World Trichology Society in New York. I've been helping women for over a decade in dealing with their hair and scalp issues, from genetic hair loss to hormone-related hair loss to hairdressing-related hair loss, and all the causes of hair loss that women suffer. I basically sit with women in consultation, run through your hair history, do a physical examination, a microscopic examination, and just holistically take all the information that's important to know, and reach a diagnosis about what's going on with your hair. And then we work through a treatment plan. And that's what I've been helping many women in Lagos and in Nigeria and even virtually to sort out over time. And particularly today, we're talking about menopause, hormonal health, and hair loss. And, this is something that, my client, many of the women that I've had to see over the years have been dealing with a lot of issues as regards hormonal health, with hair loss as regards of hormonal health, because you know how it is, you're a teenager, you're in your early 20s, and you have your hair flourishing, and then all of a sudden in your mid 20s, you get into your early 30s, things just start happening, you're wondering what's going on here, then you begin to have your babies, and then you're just get into your 40s, you're also wondering, okay, there are physiological things happening, there are changes in your body, what's really going on, and it's important to work with a professional in this regard, just the way you work with a professional with every other part of your body. We're used to going to see a dentist for our teeth. We're used to going to see the ophthalmologist for our eyes, even the skin doctor for our skin. But for hair, we would typically see our hairdressers who are largely trained in hairdressing and not necessarily in hair and scalp science. And so when we get to that point where we have irregularities with our hair growth, we get to a point where we're dealing with hair loss issues. Sometimes we don't really know what to do. And this is where I come in. This is where a trichologist comes in. But let me move into my slides. I've gone into my passions about hair and scalp care. So the truth about hair loss, and particularly today we're talking about hormone-related hair loss. And I've said here, hormonal shifts don't just live in lab results. They show up on your hair and scalp. Hair is such an interesting part of our body. Your hair is a barometer of your health. It can show up, some of the time you're feeling a bit unwell, you go to the doctor, you're not even sure how to express your symptoms. In dealing with hair, I've come to understand and realize that sometimes when you get to the root cause of your hair and scalp issue, you realize that it actually leads you into understanding other aspects of your body, on wellness and other aspects of your body. So what have I said here? Your scalp isn't just skin, it's an ecosystem. It reflects internal imbalances. Your follicles they're like mini organs, and they're sensitive to many aspects of our lives. They're sensitive to your hormones, they're sensitive to your genes, sensitive to the state of your health, sensitive to things that come into your body. So things around food, things around medication, sensitive to your diet, sensitive to stress, to stress hormones and things like that. And so, is it moving? So when you come in for a diagnosis, why should you come in? Why should you visit a professional to figure out what's going on with your hair? It's because guessing gets you nowhere. When you come in and you sit in for a consultation, many times, I have people wonder what happens. It's just my hair. I wash it, I condition it, I style it. What is it about my hair that you will look at? Sometimes you have people just say, oh, I'm having hair loss. Can you just recommend something for me? And then I say, oh, please come in. I have to have a look at it. I have to see the patterns. I have to see the indications, right? I have to have a look to be able to figure out what's going on with your hair. And what do we do when you come in for a consultation? We look at how the hair loss is happening on your scalp, right? We look at the pattern of hair loss. Sometimes you put your hands through your hair, you see hair coming out in your fingers. Sometimes you see people, their hair loss is in front. You see people, their hair loss is in the middle in like a Christmas tree form. You see people, you have hair loss in patches. All of these things are the patterns and the indications that we look at that guides us towards understanding the root cause of what's going on with your hair. Like we established, the cause of your hair loss can be from hormones, it can be from hereditary causes. I saw someone asked in the chat box about hereditary hair loss, and we'll get to it because a lot of the time, some of these things are standalone issues, and some of them are related issues, and some of them are standalone, and many of them are happening at the same time, even though they're standalone on your scalp. And so we will get into breaking down what all of these things look like and how doing a scalp examination can help us figure out what exactly is going on. Because when you have hair coming out diffusely in your hands, it's very different from hair that is patterned or, in one spot in your hair. And we'll get to that as we continue, right? So now, the power of a diagnosis, guessing gets you nowhere. So what can a scalp exam tell us? It can tell us, like I said, what kind of hair loss you are facing. It can tell us what stage of hair loss you are in, because the stage of hair loss you are in also helps us to determine how we treat, and also helps us to explain to you what your expectations can be when we are treating and managing the hair loss that you're experiencing. It also helps us to understand what to do next. So when you've come in and we've had a look and we've diagnosed and we've understood what stage of hair loss, what type of hair loss you're experiencing, what stage you are in with that hair loss, then it helps us build an actionable treatment plan on how to actually go about sorting out your hair or scalp issue. So now let's look into hormonal hair loss. It's real and it's common. It's something, when I sit in consultation and many women worry about what's going on with their hair, and I try to explain that there's nothing abnormal, so to speak, going on with you. These are things that happen in the normal progress of our lives, and it's about just, again, understanding our body so much better by seeking professional help, getting to the root cause, and then taking it from there. So when we think about, when you sit in front of me, for example, and we want to figure out what's going on with your hair, and we look underneath the microscope. I think I should move on to a different slide because it will help me better explain what we do in consultation. Have I gone? Okay. Okay, just a second, please. Okay. Oh, where have I gone? I'm sorry. Okay, so now there are different types of hair loss that are hormone related. And I'm sorry. Okay. Can you all see my screen? I'm having difficulty with my screen moving. Can you all see my screen? Can someone answer me in the chat box? Okay, all right, thank you.
Yes, sorry, we can see your screen.
Okay, all right, thank you. All right, so as I was saying, now our hair grows in cycles, as Dr. Sho explained earlier on. It grows, it rests, and it sheds. And this is a turn in a cycle of hair loss. And there are many things that allow our hair to stay in the growth phase, and there are many things that allow our hair to move from that growth phase to a resting stage. Now, there's a normal cycle, and this is a terminal cycle of hair loss, right? Where your hair grows. It can happen for about 4 to 6 to 10 years, just depending on the individual. And then your hair goes into a resting stage where it stops growing and it begins to get ready to shed from your scalp. And then the telogen phase is where it sheds. Now, this happens normally with every turn in cycle. This is why, for example, we don't grow hair from our, from our armpits all the way down to the ground, or from our eyebrows or our lashes, and we don't grow hair all the way to the ground, because you get to a terminal length and it sheds. And so all the hair on the different parts of our bodies have their terminal length. Now, and that's a turn in a cycle of hair growth. Now, with something like with a condition called telogen effluvium, which is one of the conditions that women face, a lot of women face, which is where you put your hands in your hair and it comes out in your strands, in long strands, right? Very different from breakage, right? Right now, we're not talking about when hair is broken mid-shaft in your hair. We're talking about when hair is literally coming out from your roots, right? That is a condition called telogen effluvium. It's one of the hormonal, it's one of the hormonal signs of hair loss, so to speak, right? And what causes that to happen? That would typically happen when there's been a stressful situation within the body that causes the hair to move from that growing stage quickly into a shedding stage, right? And what does that look like when we look at it physically, right? It's diffuse, so it's all over the hair, like I said. It's all over the hair strands, like I said. There are different ways that we see hair come out on our hair. Typically, when you have it diffuse, so not concentrated in one place, it's an indication and a sign of a type of hair loss that we have. It would be diffuse. Typically, it would be sudden, right? It would be noticeable, and it wouldn't be pattern. What I mean by not pattern would be that it's that you wouldn't necessarily see like a localized patch somewhere. It would just be diffuse all over the hair. And so when we notice that, and again, so that's how it shows up physically. It would also show up quite differently underneath the microscope, which is why it's important to have a microscopic examination of what's going on with your hair, because those are the patterns and indications I was talking about that lead us in a certain direction of understanding the exact type of hair loss that you have. So with telogen effluvium, like I said, it would be when there's some sort of stressful situation that has gone on within the body. And by stressful situation, what I mean is things around, for example, as Dr. Sho explained, so you have things around, for example, childbirth. It's not the childbirth that's the stressful situation. What has happened is, when like she said, like she explained in her talk, when you're pregnant, you have your hormone levels, your estrogen, your progesterone, you have very high levels of that happening. And so when that happens, the cycle of your hair growth doesn't turn, right? Your hairs generally stay in the terminal stage. They don't really move from that anagen stage into the telogen stage. They just stay there where they are. And once you have the baby and your estrogen and your progesterone levels drop, the hair moves into that telogen stage. And so when the hair moves into the telogen stage, it takes a couple of months, about 3 to 6 months, usually about an average of 4 months, right, of when the hair rests for it to shed from the hair, which is why we see postpartum hair loss happening. And I'm in the throes of postpartum hair loss right now. But of course, because I know what to do, and we'll talk about what to do afterwards, I'm in the throes of postpartum hair loss. Or well, I'm coming out of postpartum hair loss right now, so to speak. I have a 10-month-old, and my postpartum hair loss I was experiencing started at about 4 or 5 months. It's always a shock to me whenever I experience postpartum hair loss, even though I should know better. But I'm coming out of it, and you may be able to tell that, you may be able to see possibly that it's sort of, you can maybe even see some signs here, but it was so much further back a couple of months ago. But what typically happens with telogen effluvium is, like I said, it's caused by a stressor. And so typically when that stressor is removed, you should typically see the hair sort of grow back. There are other causes of telogen effluvium that are hormone related. For example, like Dr. Sho explained, menopause, right? When there's fluctuations in your hormone levels, again, it sends a signal to your follicles to rest, right? When you have lower progesterone levels, like she explained, sends a signal to your follicles to go into resting stage and then shed, and that's what you have there. And I will, as I continue, because I want to talk about one or two other causes of hormonal hair loss, I will show you some microscopic images I took a couple of days ago, actually, from some consultations that I did to just help you understand what it is that we look for, right? To figure out what exactly is the root cause of your issue. Now, we also look at androgenetic alopecia, because somebody actually brought this up in the chat box I saw, and the person said, oh, what if it's genetic? So yes, genetic hair loss is caused by, so Dr. Shu spoke a lot about DHT. Genetic hair loss is caused by it's not caused by the amount of DHT in your body. It's really caused more by having a sort of genetic sensitivity or genetic predisposition to having follicles that are sensitive to DHT, right? And so this is something that, again, it's not something that you are causing, because a lot of the time when people sit in consultation, they want to blame the last hairdresser. I always feel so sorry for this previous hairdresser, because she's always the cause of the issue, but not necessarily so. Like I said, it's about a genetic sensitivity of the follicles to DHT, which again, yes, it's genetic, but again, it's from a hormonal sort of chain or line that we get into that. Yes, if you have that genetic sensitivity to, if your follicles have that genetic sensitivity to to DHT, to that conversion from testosterone to DHT, then of course you will experience genetic hair loss. And genetic hair loss shows up differently from telogen effluvium, even though they are both from hormonal causes. Usually genetic androgenetic alopecia would be patterned. So that's typically when you see hair loss that's not diffuse and all over the place. For men, it will typically start from the temples and go in. For women, it will typically start in the crown area and sort of come out that way in what we call like a Christmas tree pattern. It's usually patterned, right? And then under a microscope, again, there are some indications that we see that allows us to realize that it's different. It's a different situation. We are looking at androgenetic alopecia and telogen effluvium. And bottom line, hormonal hair loss doesn't always look the same, but it always leaves clues. My slides. Maxing up. Uh-oh. Uh-oh.
Can't see your
Okay.
slides anymore.
I realized.
Okay, it's come back on.
Okay. 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 So again, Dr. Shu spoke quite a bit about stress as well. As a cause of hair loss. And again, what happens here is, when now we're talking mental stress. We're not even necessarily talking of those other stressors I spoke about in your body, right? That would typically cause telogen effluvium. Now we're talking of things around your cortisol levels, right? So things around lack of sleep. In consultation a couple of days ago, I had someone who came in and she had a patch right at the back of her ear there. And she'd been experiencing it for about 10 years, off and on. She said it had happened about 3 or 4 times. And when we dug deep and we went into the historical analysis, and I just asked a bunch of questions about, and I looked at it under the microscope. Again, those patterns and indications that will lead us into understanding what's going on. I just asked her, about her general health, right? And then I explained to her that what was going on was really more related to, some sort of physical stress within her body. Well, and she really wanted the consultation to be about me recommending some sort of shampoo or conditioner to her. And then I just asked her about just her lifestyle. And then she explained that she was having trouble sleeping, and she would sleep maybe 1 hour or 2 hours at a time at night, and she would wake up even more tired than when she went to bed. And so what happens is that, because you know, of the cortisol levels in her body, right? It disrupts the growth cycle, you know, and that can lead your hair to go into shedding stage very quickly. Again, about 3 or 4 months. And some people even experience this shedding even 1 month after the stressor has happened. But usually, generally speaking, with hair, we always like to look at a 3 or 4 month mark to make that decision as to what the root cause could have been. So again, you know, like I put here, stress doesn't just steal your peace, you know, it steals your head too. And so again, we will talk about how to deal with these situations as we proceed. So I was talking about what we see under the microscope that allows us to determine what sort of hair loss you are experiencing, because if we don't know the root cause, then we can't deal with it as we should. So with telogen effluvium, what does that look like? I think I have some pictures here actually. Okay, so I'll explain that to you. So let me explain it to you, and then I will show you the photos so you can understand. So with telogen effluvium, because like I said, it's diffuse thinning and it's typically caused by some sort of stressor that is typically not a sort of permanent situation in the body. So like or it could be, you know, sometimes when that happens, you have chronic telogen effluvium, but usually with things around with things around childbirth, you know, or any other sort of thing that comes within the body that makes the hair loss diffuse. Typically, when we look underneath the microscope, we would see empty follicles, right? We would so we would see empty follicles. That makes us okay. There are some follicles here. Will hair grow out? Will hair not grow out? And I'll show it to you. Typically, you would see some short hairs as well. So you would see empty follicles. You would see short hairs, and you would see an even diameter of hair strands across the scalp. And what do I mean by that? It's different in androgenetic alopecia, where you would have different strand sizes on when we examine the scalp. I'll show you to you in this photo here. So for example, if the photo, if you look at the photo for telogen effluvium, you can see that the strands are quite thick all over. And then if you look, you will see that there are some empty follicles. And then towards the right, I don't know if you see like a black stub, right? It shows you some hairs that are regrowing. So typically, again, because like I said, the shedding is diffuse, but it's not in a way where we're losing hair permanently. You know, it would typically tend to grow back and grow back as thick as when before it was shed. Different from androgenetic alopecia, where you have that the DHT within your system, right? That is causing you to lose hair sort of gradually, where intelligent effluvium, it will be more, like I said, sudden. And so because of that gradual loss, when the hair falls out of the follicle, we have what we call miniaturization, where the follicle shrinks and then thinner hairs begin to grow out. So it's important to do an examination to be able to tell, am I experiencing androgenetic alopecia or am I experiencing telogen effluvium? Very important. And then you know, there are other forms of hair loss that don't necessarily have to do with hormonal irregularities. However, they can to the untrained sort of eye, they can show up as similar. And then sometimes, because of the practices around how we wear our hair, it becomes a bit difficult for you to tell what the cause of your hair loss could be. On the left, I've shown a diagram of something called CCCA, which is the central centrifugal cicatricial alopecia, which typically is what we call scarring hair loss, and happens a lot of the time when we put a lot of pressure or tension or chemical relaxers and things of that nature on our scalps. And if you look at the example of the CCCA, you would see more sorts of discoloration. You would see very thin hairs around very thick hairs, but you would see regrowth in a way where the hairs are not the regrowth is not thick. It's just growing back very thin, and you can see so much space on the scalp. And CCCA is one of the most is one of the I say avoid traction alopecia, which is hair loss from dramatic pulling. where there's some sort of dramatic force that has pulled the hair strands out of the hair, because it's one of the most difficult to sort out. Because when hair is dramatically pulled from the follicle will see it as a wound and try to heal as scar tissue. And once that has happened, it's almost impossible to bring the hair out of the scalp anymore. Okay.
Sorry, I think we might have lost Koyin for a second. Um, I'm sure she's going to be trying to get back, but already it's been a very riveting learning from I feel like I'm learning a lot, and it's also taking me back to medical school and GP training, when we were learning about all these different types of hair loss and looking at them, talking about how they look under microscope. So it's been very interesting. So we'll just wait for Koyin to come back, but whilst we're doing that, we can start answering a few questions. So I can see that someone has asked, what can we do about hair loss that occurred after a first time perm? So I think that's probably a good question for Koyin. If anyone has questions about menopause or hormonal hair loss they would like to ask, whilst we wait for Koyin to get back, then I'd be very happy to answer those. And can also, David, allow me to put on my video, if you don't mind. So any questions about menopause, hormonal hair loss, um, I would be very happy to start answering some of those questions. So you If someone's asked, is DHT the only culprit for miniaturization? Can your DHT be normal and you still experience that? So as Koyin was explaining, it's not just about your DHT levels, because it's also about your sensitivity to DHT. So some women, say for example, if you've got PCOS or during the postmenopausal phase, you might have higher levels of DHT. But then there are certain women who will be more sensitive to DHT as a result of genetic predispositions. And so this is why you kind of almost need a personalized approach, because your DHT levels, like for example, you may not necessarily have PCOS, or your testosterone levels might not be particularly raised, but you have a sensitivity to a genetic predisposition, and so you get female pattern hair loss, and that's a genetic predisposition, and then you can still experience miniaturization of the follicles. I hope that answers your question. Okay, so someone has asked, hi, my hair has been shedding more during menopause. What could be the cause? It grows to shoulder length and then starts breaking at the crown and edges. This has happened twice since I entered menopause. So as I've explained, the hormonal changes that happen in the menopause is that your estrogen levels and your progesterone levels drop. And as we talked about it, estrogen and progesterone are protective. They are protective of the hair follicles. So when you have that, then when you have that drop, testosterone, which is not necessarily elevated because your testosterone also drops during menopause, but it's just more prominent. And therefore, for a lot of women, you can then get thinning of the hair follicle of the hair due to DHT or the testosterone being more prominent and the lack of protection of the hair follicles from the estrogen and progesterone. But also that hormonal shift can cause like a telogen effluvium kind of picture. So pushing the hair into the rest phase, and that causes the breaking and the shedding of the hair. So that can be why you get that thinning and breakage in the menopause. So again, how you can manage it, obviously hair care is really crucial. I'm just seeing I don't know what's happening with Koyin because she'd be so good to kind of contribute to how much you can do from a hair care perspective. But from a hormonal perspective, of course, we can look into hormonal treatment options for this. And there's, options like we talked about HRT, depending on how severe the situation is. So some women who have androgenetic hair loss, as Koyin was saying, so some women who are having female pattern hair loss and it's really impacting them, we can look into things like spironolactone and finasteride, minoxidil, and other treatment options. But of course, hair care is so important. That's why it would be helpful to see a trichologist like Koyin who can then talk to you about the hair care products and things that you need to help support your hair in that phase. But remember, we also need to check things like your thyroid hormone, which I mentioned, because thyroid hormone, if it's abnormal, which can often happen within the menopause, your iron levels could be low. Again, zinc levels could be low. Those can impact the hair quality and cause that thinning. So we would always check that. I would always check that as well and optimize your iron levels. I often say that for good hair growth, you really want your iron levels to be well above 50. And so that's your ferritin levels to be above 50. Some people even say 75 to ensure that good health. Oh, yay, we've got Koyi back. I'm so relieved. Wow. Someone has asked about, can hormonal disorders cause cancer? I think that is a really loaded question. I'm going to let Koyin talk, get back into Koyin's talk, and then we can get back to that question. But I haven't ignored it. I've seen it, and we'll talk about it.
Sorry about that, everybody. I won't bore you with the explanation for what happened. Let me just get right into it so that we can answer your questions and sort you out as best as we can on here. So, I had explained about, just basically why you need to partner with a professional so that we can sort of lead you in the right direction. I think I've spoken about this, why you need a scalp consultation, what we do, with the
Koyin, we
trichologist.
can't see your slides.
Oh, you can't see my slides. I'm so sorry.
Share again.
Where are we? Where are we? Where are we? Okay. Share. There you are. Can you see it? Okay. All right.
Yeah.
Okay. Okay, so like I said, I was talking about why you need a scalp consultation because we can, let you know exactly what that cause of your hair loss is. And even if it's hormonal, we can still, because again, what we look at with traction hair loss, different from what we look at with CCCA, different from what we look at with so many other different types of conditions with hair loss, even things around seborrheic dermatitis. And sometimes you have some of these situations, like I said, where you can have one or more. You can have telogen effluvium and androgenetic alopecia happening at the same time, which is why, again, when people say, oh, you come in with your hair, for example, in cornrows or braided and say, oh, because again, I had that happen. In fact, I had to move a consultation yesterday because, she had her hair in cornrows and she said, oh, I can just show you the spot over there. And I say, no, we need to see your entire head of hair because you can have one or more, two, three situations happening at the same time. You can have androgenetic, you can have telogen effluvium. We can be looking at flakes on your scalp. And all of those things we need to, look at individually. And then, that leads us to what that holistic plan would look like. In terms of treating telogen effluvium, you identify and you remove the trigger. So like we said, if the issue has to do with any sort of stressor, whether it's starting or stopping some sort of medication, whether it has anything to do with menopause, whether it's about childbirth, if we can remove a trigger, we do. If we can't, then if we realize that it's something that is ongoing within your body and there's not that much that we can do in terms of removing that trigger, that is when we then move you to see people like Dr. Shaw, who can then layer, basically we would have a management routine for you, and then they can deal with you more internally. In terms of androgenetic, I'm really trying to go on because I don't want to waste any more of your time because I got cut off. But again, in terms of things around androgenetic alopecia, for us, right, we would typically look to things around DHT blockers. Again, this is not something that you just take without contacting your doctor because there are other issues around your wellness and your body and whatnot, and we need to make sure that these are not things that will be harmful to you, right? So we'll typically go along the routes of DHT blockers. Some are topical, some are supplements that you have to take internally. And so typically when you have these DHT inhibitors, like Dr. Sho had spoken about finasteride, she has spoken about spironolactone and all of that. And those are things that will typically come in to sort of manage the AGA. We also have, next one, how do we then stay on top of managing issues around hair loss and hormone-related hair loss? Like I said, stay ahead of DHT. It's just very important. It's just good to always understand what's happening in that regard and then stay on top of it, either with DHT blockers and then also things around growth stimulants. And because sometimes what happens is when hair sheds from the follicle needs to be reminded, needs to be stimulated to grow new hairs. And so, stimulating with, again, like Dr. Sho had said, there are some herbal things that help to stimulate growth, things around saw palmetto, rosemary oils, and things like that. We also have light therapy, low-level laser light therapy that can help to stimulate growth. What low-level laser light therapy also does is that, like I said, with every turn-in cycle, the follicle shrinks. With miniaturization, the follicle shrinks. And so what happens is that the laser light therapy helps to widen the follicle so that thicker hairs will grow out. Again, prioritize scalp care. Like I said, healthy scalps grow healthy hair. And so prioritizing, because again, sometimes, like I said, when you have things like AGA, sometimes the DHT also has a way of producing excess sebum, which is your scalp oils, and that's why sometimes you would see cases of androgenetic alopecia with seborrheic dermatitis. So again, prioritizing scalp health just allows for better quality hair to grow. It's like grass. The more you sort of like take care of it, the better the quality of the grass that grows out of it. So again, prioritizing scalp care, treating hormone shifts early. If you come in and you see us and we realize that, oh, okay, it seems like you're having some sort of irregularity, we can then refer you to someone like Dr. Sho, who typically, because she's not based here, but she could do virtual consultations for you, and then and the required testing, because she does have the practice on the ground here now, which is launched not too long ago. I'm sure she'll talk more about that and later on. And then again, just managing stress intentionally. Like I said, there are those stressors that that affect our cortisol levels that then have an impact on follicular activity. That makes our hair go into that telogen stage unnecessarily. So again, managing and stress in the best way we know how. Dr. Sho has told us things around, going into nature, taking time to set boundaries and to rest, and all of those good things. Like I said, hair health is a lifestyle. It's not a rescue mission. It's not at the point in time where you are having we take care of our skin even before we realize that we have a problem with our skin. We are much more preventative with our skin, but with our hair, it's almost like we wait until there's a problem. And then again, there's also the nuance around Black women and just the mental conditioning that we have about our hair. But I don't think I want to get into that today. That's a separate webinar, just in terms of how we've treated our hair from when we were children and how we don't really, we've never really gotten to know our hair. Our hair is outsourced. It's always, every weekend, go sit back, have it washed, have it plaited. We have no idea who I would say who our hair is, so to speak. But like I said, that's a different webinar, and that's when I'm talking more passionately. So let's talk about when to see a doctor versus when to see a trichologist, because sometimes you have people not really quite know what to do. First things first, my hope for you is that when you see a trichologist, that is a trichologist with integrity, that is able to lead you in the right direction, as opposed to just keeping you in their practice and sending you on a wild goose chase, because that happens. The moment I see something that is beyond the bounds of trichology, or that I don't understand. For example, yesterday I did a consultation. Under the microscopic check, I saw black dots on this person's scalp, and I just thought, black dots. This wasn't discoloration or inflammation. This was black dots, and I thought, black dots. I have no idea what this is. And I quickly told her, I said, I'm going to have to refer you to someone, because there's just some irregularities. I didn't want to frighten her, but there's just some irregularities that I think is beyond the scope. Only to find out she'd been putting hair mascara, if you know what that is. She'd been putting sort of hair mascara to sort of mask her edges. And then, but my hope for you is that you see a trichologist that has integrity enough to let you know where the scope sort of starts and stops. You should see a trichologist if you have things around scalp buildup, flakes on your scalp, your hair is thinning, your hair is shedding, but there isn't any sort of inflammation. You're looking for scalp stimulation. You're looking for management and support with your hair, depending on even if it's postpartum hair loss, management and support in that regard, where whilst you're or nutritional hair loss, where whilst you're dealing with the internal stressor, we can help you sort of manage and maintain. And then you see a doctor when you have things like pain, burning. We know that you have autoimmune symptoms, when you have sores, when you have what's it called? So that sort of thyroid and menstrual irregularities, where we need their input, right, to deal with those issues internally. Or like I said, if there's like physical open wounds, you need someone else to have a look at that, and then come to us to then deal with the things around, like I said, management, support, and whatnot. We can also, when we do a consultation, just, do a referral that gives your doctor an insight into what we as trichologists are trained to see, and then they take it from there with all the other symptoms that you have, and then do their own testing. Final thoughts: your hair tells a story. Partner with a professional to help you rewrite that story about your hair. And start listening to what your hair is trying to say, because your hair speaks. You just have to listen. It's a barometer of your health. The patterns and indications of how things are happening on your scalp will give an insight into so many of the wellness issues that you are trying to deal with. And that's it from me. Happy to answer many of your questions now.
Koyin, thank you. That was fantastic. And even though, technology tried to fight us, we got there in the end. So I'm so grateful that there have been questions coming through. So there was one question, Koyin, for you,
Okay.
where somebody asked, what can we do about hair loss that has occurred after a first-time perm?
After a first time perm.
Which I assume is like relaxing.
Yes, yes. Oof. Those are the situations that really break my heart, because it's so unnecessary. What to do after a first time perm? Again, you first thing to always do is to see a professional, so that one can have a look at your scalp. If one isn't having a look at your scalp, it's not as straightforward to give a sense of direction. So first things first, we want to have a look at your scalp. I would also say, on your own, if you made a relationship between relaxing your hair and experiencing hair loss quickly after, of course, it goes without saying that you pause and take a second away from the relaxer, while you take some time to go and see a professional who can have a look at your scalp and see what the state of your scalp is. Hopefully you don't have any scarring. Hopefully it's maybe breakage at the root, in which case there isn't clear skin. Because if there's clear skin, if it feels like patchy hair loss, where you're still not feeling bare, where you're still feeling some hair there, then signs of hope. If it's patchy, yeah, that's something a little bit more intricate. and we can deal with it. But again, just quickly see someone so that we can figure it out for you.
Okay, so there's a couple of questions. Someone's asked me, since
Mhm.
Dr. Sho, since you
Sure.
offer virtual consultations, do you not find not being able to examine the pattern of the hair loss or condition of the scalp presents an incomplete picture? So this is why, I'm not a trichologist. So if you want, to have a specific examination of the pattern of the hair loss, you really need to see a trichologist. What I'm able to provide is about the hormonal health, whether it be your thyroid, whether it be PCOS, and you have androgenetic hair loss, and you need a DHT blocker, whether it be that you have a nutritional deficiency, and you need iron, and you need your iron levels checked, and you need iron or zinc support, whatever, or you might have seborrheic dermatitis, which again is a condition that will probably sit in between the medical and the trichologist, because sometimes for the seborrheic dermatitis, you might need steroid treatments, and if it's an autoimmune issue, so sometimes I might be able to support that. Sometimes I might have to refer you on to rheumatologists, depending on what it is. So again, there are things that as a clinician and as a hormonal specialist, as a women's health specialist, I'll be able to support. And a lot of that can be done virtually. As I said, we've got a clinic, we've got ability to do blood tests and things on ground. Now, I do have a clinician that works with me that is able to do physical examinations for what is needed. So again, it's something that we can manage. And really, the hair care is done by the trichologist. That's why we say we work together. And that's why we're having this consultation, this today. Now,
can I comment on that
yes,
as well?
please, of course.
So yes, so like I said towards the end of my presentation, right, which is why when you sit and we analyze and we look at all of the symptoms that you've presented us with, it then gives, so in even making that referral, it just gives us a sense of what is happening, whether the pattern and indication we're looking at seems to be more from a hormonal nature, or seems to be more around a nutritional nature, and that is why we do that examination and then make that referral. Looks like you're dealing with some sort of hormonal hair loss. Go see Dr. Sho, and then she can now do the necessary testing, not for your hair, but now for your body, in terms of how do we get through whatever hormonal irregularity you're experiencing, which in doing so should then improve the state of your hair, and then you come back to us and then we manage and we support. Yes.
Exactly. Now, someone's asked about, can hormonal disorders cause cancer? Now, this is a very, I think, complicated question to ask, because usually hormonal issues are not necessarily related to cancer. So you've got a thyroid abnormality or a menopausal problem, but sometimes some cancers can cause issues with the endocrine system. So we have something like the syndrome of the inappropriate antidiuretic hormone, for example, which is a hormonal condition that can be caused by certain cancers. And also an imbalance in certain hormones. So like, say, for example, when you have PCOS and it's a hormonal disorder, it can predispose you or put you at increased risk of endometrial cancer. So it's a risk factor. So there are certain hormonal problems that can be a risk factor for certain cancers. But hormonal problems in themselves are not cancerous. But this is why you need to see a specialist if you are concerned about certain hormonal issues. So for example, something like PCOS, if you have that condition, you need to see someone who really understands it, because as I said, it's not just it doesn't just affect your reproductive hormone, it doesn't just affect your health, your hair health, but it actually also can impact your risk of diabetes, heart disease, strokes, and also can increase your risk of endometrial cancer, womb cancer. So again, hormonal problems, depending on what they are, you need to see the right person to have these conversations, and your hair can be a hint that you have a problem, and someone like Koyin can see an issue with your hair that suggests you need to see someone like me, who can then do the holistic assessment of your physical health. Right. I'm curious. So somebody says, I'll be absolutely setting an appointment with you. I'm so curious. How are you able to tell if someone has a genetic sensitivity to DHT? Oh, you muted. You're muted. You're muted.
Yes, I can't unmute myself.
Sorry, you're unmuted.
Okay. What was the question? How can you tell if you have a genetic sensitivity to
To
hair loss,
DHT.
to DHT, to DHT? Again, so this is, I've stopped sharing my slides if I was still sharing it. Again, these are the patterns and the indications that we look at that I was talking about. So it will show up in a specific way when we have a look at it. So DHT related hair loss would typically, again, and this is why we need to know the history, and we ask a lot of questions. And in the beginning I'd have people get a little bit irritated, like I was trying to be nosy, because again, trichology is a field that people are just getting to understand. And so AGA, androgenetic alopecia, or AGA, it would typically show up in a gradual way, different from like telogen effluvium that would show up suddenly. So it would typically show up gradually, and then it would be patterned. It wouldn't be all over your scalp, or it wouldn't be like just like, so for example, there's hair loss where you just see a band right in front of the person's head, just a band like that. That indicates something. There's hair loss where you see it like a C that way. That indicates something else. And so with AGA, I keep saying AGA, androgenetic alopecia in men, again, it shows up different from the way it shows up with women. With women, you would see it show up in the middle there, and it would open up in like a Christmas tree pattern. So now CCCA, which is the scarring hair loss I spoke about earlier, also does the same thing, where it sort of shows up in the middle and widens up like a Christmas tree pattern. But if we look under a microscope, we will see that AGA would typically have the discoloration you would see with CCCA would be sort of would I say, so the scalp would look raised. The discoloration would be sort of like a bruise, like when there's a bruise on your hand, and how it looks a little, in Black people, it would look more like dark blue, so to speak. I've stopped sharing my screen, but you will see that way. You would see hair strands that are different sizes, right? Even like, as much as you would see empty follicles. So you would see different sizes of hair strands across just a tiny little cross section of hair. That's how you'd be able to know. And then regrowth, for example, in telogen effluvium would be just as thick as the hairs that fell out, and it would be more sort of like upright. In androgenetic alopecia, it would grow almost like a curve. It would be much thinner than the rest of the hairs on the head. So it's things like that that basically just gives us an indication of what it is that we're looking at. Again, also asking if there's a history of hair loss in the family. Sometimes people say, oh no, but it skips generations as well. So basically my point is, it's patterned. It's about where exactly it's located on the scalp. It's about what it also looks like underneath the microscope when we examine. It's about how exactly it's growing back, and things like that. And that's how we figure it out.
Fantastic. And she says, Koyin, hopefully one day technology will allow you to offer virtual consultations also, because I'll be first in line, which is fantastic.
Sure.
Right. So we are actually, we've hit time. It's 9 or 3 past 9, but we're happy to stay. We'll let people go, because obviously we want to honor your time and we're really grateful. But we're happy to stay and answer a few more questions. We, especially if people want to ask questions in person, we can switch off the recording. So we'll end it here and say thank you so much. Koyin, thank you so much for being here. But if people want to answer questions, feel free to stay for another 10, 15 minutes and we can have a conversation and ask questions.